Hi guys, how we doing? It's Greg from Growing Older Gratefully. As they say, it's been a minute since I made a video. My wife and I, we had some things going on in our lives that really would be for another video, but let's just say it kind of put the focus on taking care of something else and me not really finding the time necessarily to make videos. But the day of really when I started the videos of what the purpose was me doing a video blog of documenting my hip replacement surgery that ultimately was going to lead to medically what they say is a bilateral, which would be the 2 hip replacements. So that occurred yesterday, because yesterday was December 1st, was 7 weeks after my initial hip replacement on my left hip, which was October 13th. So I had my surgery yesterday. Things went very well, the same as they had done the first time. The surgeon was very happy with the results. That makes me happy. Things went very well. This is day 1 after my second surgery. I'm feeling pretty good. One thing I will say is, on a good note starting out, is I don't seem to have the same amount of pain in my right that was just surgically repaired yesterday versus my first hip, October 13th. So I'm hoping maybe that continues, and maybe the recovery with that, with the pain, the soreness, and so forth, maybe it won't be as severe as the first time. One thing I will say is leading up to the second surgery, I felt very good about the surgical procedure itself. When I was had to be there at 6 a.m. yesterday, going into the surgical center, kind of laughing, joking with the staff, most of which were the same people from the first time. Because, I mean, really, in reality, the good thing is, like I explained to them, was I kind of knew what to expect surgery-wise. Now, of course, I'm explaining to you what I had mentioned to them, my wife, too. My fear was not the surgery, because like I said, felt very comfortable, confident in that. What I didn't feel confident is what's going to take place now is my recovery, which my recovery for 7 weeks involved 1 hip. So now I'm at the point, day 1 of a left hip that's 7 weeks into recovery, and a right hip, which is day 1. So I'm kind of worried about how that's all going to play into it. Hopefully the 7 weeks on the first hip was kind of enough, and I realize it's still early in the process. I get all that. But I'm kind of hoping that 7 weeks was a pretty good jump start, that I can count on that left hip now and my left side to kind of help me counterbalance the initial start of getting going on the right hip. So today, just as I have done, as I did the first surgery, right afterward today, I was already doing on my own some physical exercises, just some gentle walking, not too much, but enough. Same thing, I'm going to keep myself cooped up upstairs on my second story for at least 2 days, maybe 3 days, probably no longer than 4, which I may wait till my first actual outpatient physical therapy session, which will be mid to late week. I've got to cement that schedule, but shouldn't be longer than maybe about a half a week or so to actually get with my therapist again. So as far as everything's going, day 1 I'm feeling good. Emotionally, like I said, I'm worried about the recovery, as anybody would be, as I was the first time. But now it's the multi-part, the bilateral part of it. But now, one thing I will say with that is I think the fact that even from the beginning of the first hip replacement, in my mind I always knew possibly the second one was coming, and it was just a matter of when. And then when it was decided it was going to be fairly quickly, anywhere from 4 to 8 weeks, and ended up being 7. That was always in the back of my mind that, hey, regardless how I feel about how the procedure is going to go, that recovery is going to be a because now it's involving a fresh hip, surgically repaired, replaced, to one that's still really hot and heavy in the process of the recovery part of that as well. So now I know that, like today, I've been psyching myself up. I know there's going to be a lot of, the road to recovery is not going to be simple. I know that. But now I'm convinced that I've got both procedures over with. I will tell you this, and as I'm making these videos going forward, I'm going to work my tail off. There's no question. My goal, obviously, is to get back where I can just do daily functions without pain, being able to get around, have my mobility back. That's first and foremost. Now, then my second part would be as an avid race walker. Since 2017, I'd like to get back to that. I was very competitive. I was very successful at it. I also have, however, I have changed my mind frame, my mindset there. I'm not looking necessarily to get back to what I was, a few years ago, a couple years ago, heck, even 6 months, a year ago. I'm going to just try to build up and get back to my race walking, but be the best that I can at this particular moment in my life. With 2 brand new hips, some of my friends would say bionic hips, we'll see. But if I can just do the first part of it, which is just daily activities, and not have the excruciating pain that I was dealing with, the constant pain. It was daily, it was hourly. I did the best I could with it, and now it's time for me. Like I said, if I can have that eliminated, the race walking is secondary. But that is also my goal on top of just just getting back to say possibly what I was, just daily activities a few years back. I'm not even sure. Honestly, the doctor, my surgeon, had said this has been going on for a while, and of course it builds up as it was going through the years to where finally it was going to pretty much cripple me up. I was going to be on a walker, definitely, at least a cane. So I'm grateful that things kind of all worked itself out. I am also grateful. I have noticed with certain things that have come up with the second procedure, the fact that I did it before year end, it's going to make a huge difference in because pretty much what it's done is my deductible's paid for it. Now it's a matter of what's going to not be, there was a difference in deductible and out of pocket. So I've met my deductible. I just have to see what kind of lingers on the out of pocket. But already some of the bills I've paid are considerably, ridiculously less. So I'm grateful it all worked out, and I'm also grateful that I had enough time frame with that situation to not rush the surgeries, because I know my wife was very worried. Hey, let's not push this for 2 weeks, 4 weeks later. Maybe that's too soon. Knowing that she loves me, cares for me, I bought into that too. And when finally the doctor had said, well, let's push mid-November to December 1st, honestly, I was grateful. As long as he'd have said any time before, December 31st and beyond that date, before that date, I was going to be happy. But with that, guys, I just wanted to touch base again. It's been, like I said, it's been a minute since I've done a video. And now the real journey of what started out as me knowing full well that it was going to be a bilateral hip replacement has finally happened. And now I can concentrate on my full recovery without trying to recover, looking forward to the next surgical procedure. So with that, guys, I just want to say, I'm hoping for the best, but I will tell you, hope is one thing, but you also have to work hard, and I intend to work very hard. So I will talk at you guys in a couple of days. Today was, and I didn't say that earlier, I should have said today is Saturday, December 2nd. I'm in Fort Walton Beach, Florida. It's about 9:15 Central Time, p.m. So I hope everybody has a great rest of the night, and I will talk at you in a few days. And hopefully you can kind of see it in my voice and in my face that I'm excited, even though I'm afraid, and even though I know it's going to be a lot of hard work, but I'm excited now because now I feel it's truly just all uphill. So with that, I'm going to leave it at that, and everyone have a great night, and I will talk at you later. Good night.